Okay, so this is our video discussing shoulder arthroplasty pre-op questions and frequently asked questions, which are typically have everything to do with the surgery itself and recovery, etc. So I have found in my practice that these videos are incredibly helpful to our patients, and they love them because it gets down to a lot of the questions that people have, and people have similar concerns and questions going into these operations, and hopefully this video will give you a little bit of peace of mind about the procedure and how we do it, and we are unique. So I just want to start by saying in the beginning, like a little disclaimer. So this is for the vast majority of shoulder replacements. This isn't for every shoulder replacement. Each situation is unique, but this is for 90-95% of our patients undergoing shoulder replacements. If you have a revision or special circumstances or certain things, we may modify this a little bit. Okay, so understand that, and it depends, but this is for the vast majority of our patients. So, and again, our mission as a practice is to fix your shoulder as quickly as possible, as best as we possibly can, and make the overall journey and experience for you as pleasant as possible, right? That's our journey. And so this video is part of that. It wants to go in some of the details. We are unique in many ways, and a lot of it is just how quickly we let you move your shoulder and some of the other things we do in our practice. And again, that's all geared towards outcomes and experience. We want to make it a great experience for you. We want to get your shoulder as good as we can, as fast as possible. And again, we discuss a lot of the stuff you're going to look up online. If you look at other resources, I tell people it's actually not wrong per se. It's just old data, right? It's archaic, or I shouldn't say archaic, but it's stuff from 15, 20, 30 years ago, and things are changing, right? And so medicine, the world, and shoulder surgery is no different, is evolving at a very quick pace. And so we stay on top of all those things and are constantly looking to evolve and change. So it's not that stuff is wrong, it's just old data, right? And so we perform modern shoulder surgery, and modern shoulder surgery done with state-of-the-art techniques and rehab techniques, etc., is different than a lot of the things you're looking at online. So just know that that's why you're going to see some unique things in this video, and maybe hear some unique things that you haven't heard before. And again, going into this just from a mindset standpoint, a lot of patients look at this operation as, I'm going to have to give up so much of my life in order to get what I want. Like I'm going to have to make this huge sacrifice. And what our goal is to minimize that sacrifice, right? To minimize the amount of pain that you have after surgery, to minimize the amount of downtime that you have after the operation, so that you don't hit this huge dip in your life in order to get where you want to be with your shoulder. We hope it's just it goes like this, right? Or maybe just a little bit. Okay, that's the key for this whole process. If I had a magic wand where I could just fix your shoulder in the office, I would use it, but I don't have a magic wand, but I have something very close, which is a shoulder replacement. And just remember that this is, the first step. Watching this video is a step towards fixing a problem that's really taking away a lot of things that are precious to you in your life, whether it's your sleep, activities you love, you're doing things with your family, throwing a ball with your son or grandchild, picking up your kids or your grandbabies, or just getting through the day. So, we're excited that you're watching this, and hopefully you're either thinking about getting your shoulder replaced or you're ready to get it replaced, and kind of keep your mind on how awesome your life's going to be once we fix this problem. Out of all the surgeries I do, shoulder arthroplasty makes the largest impact on the patient's quality of life, because you have someone that's down here from a functional standpoint, right? And how much pain they have, and how long they've been dealing with the pain, and how much it inhibits what they want to do in life, and where we take them. It's a dramatic change, right? So I love this surgery because this is the one where people come in, they want to give you a hug, right, after the operation, because they're so happy for how much better they feel compared to afterwards. And all the surgeries that we do in the shoulder work, but few are as dramatic in terms of where people start and where they end up as arthroplasty. All right, so let's get started. So before your operation, we're going to decide you're going to have the operation. You're going to get a pre-op appointment, and a lot of this stuff will be reviewed. Before you come in for that pre-op appointment, make sure you watch this video, because it'll answer all your questions about the surgery, and we can just drive home any other issues you have or things that we didn't cover in this, which this video should cover about 99% of your questions. But yeah, make sure you watch this video before your pre-op appointment, but you'll get your shoulder replacement booked. We'll get everything scheduled, set up. You're gonna get a CT scan scheduled so we can do our computer mapping program. But then you're gonna come in before the operation and you're gonna, answer any questions. You're gonna get your sling and you're gonna talk about medications, dressings, etc. But people want to know, what can I do before that pre-op appointment? Well, watch the video. That's number one. They want to know about diet. So diet is important, and we know this from a lot of our data. And I'm actually developing a protein powder with one of my co-surgeons in Oregon. But for now, just make sure you eat plenty of protein. And what does that actually mean? Well, let's say I tell people try to eat like 0.75 grams per pound of weight. That's a good rough estimate. So like 100 or 200 pound man would want to eat 150 grams. If you were a 150 pound woman, it would be around 100-ish grams, I would say 100, 110. But just make sure that you're eating a large portion of protein with every meal, 30 to 40 grams, which is a lot. And also trying to supplement with either protein bars or protein shakes. That's a huge key because we're going into your body, we're making incisions, we need you to heal. And in order to have good healing, you need to make sure your protein levels are high. So make sure you're doing that for at least 2 to 3 weeks coming in if you can, and really through the whole recovery process. It's super important that you're eating protein beforehand and then you're eating protein in your diet afterwards. And what does that mean? Try to get 30 to 40 grams per meal and then a supplement afterwards. And it doesn't have to be that big, but women maybe 20 grams, men 30 to 40. Exercise. So people want to know about this. Exercise before you go into surgery, you'll feel better. Your physiology will be higher. Your mood will be better. Your ability to kind of get through stressful events will be higher if you're exercising on a regular basis. Try to do things that don't irritate your shoulder as much. You're not going to damage it, but it'll just, life's too short. So why make yourself miserable? Try to get your therapy set up. This is something that we're really stressing this year. I want you to know where you're going to therapy. I want them to have the protocols, but I would like for you to get this set up beforehand so you have all the systems in place so that, after the operation, you already know where you're going to therapy. You already know what you're going to do. You've met your therapist and it's all just kind of set up already. So you don't have to stress out or worry about that. It's all kind of rolling. Decide on your follow-up. So, with shoulder arthroplasty, there's no sutures to take out, but you can do the majority of your follow-up actually through telemedicine if you would like. If you want to come in person, you can come in person. Typically, we see you at 2 weeks and then either at 3 or 6 months. For sure 6 months, but sometimes 3 months if you want. But that 2 week and 3 month appointment can actually just be through telemedicine, which is a fancy word for just saying a phone call. And we can just check and see how you're doing and do everything over the phone because there's no sutures to take out. And as long as everything looks clean and it's the way we should be, that's perfectly fine. But we'd like you to set that up before the operation so there's no confusion afterwards. You're going to get some forms sent to us about your shoulder score, they're called PROM scores, which is patient reported outcomes. This is super important. Make sure you fill these out. This allows us to track our data, which is precious for 10,000 reasons, but really just think of it as we're always looking at what we're doing and how to get better. How can we constantly get better? How can we analyze what we're doing? How can we continue to improve? And it's difficult for us to do that unless we have objective evidence of how our patients are before and after surgery. So please make sure you fill out those forms. It'll be from something called CareSense. And then get your pain meds. Get your pain meds. We'll get all that stuff set up at your pre-op appointment. Make sure you have your pain meds set up, and after the pre-op appointment, get those before the operation. So that goes into pain control, pain meds. This is a big question people have. So what do we do? Well, we have a medical grade CBD, which is essentially an over-the-counter medicine that works well for a lot of people. I would encourage you to try that. It's very low risk. We do ibuprofen, 4 pills 3 times a day, Tylenol, 2 pills 3 times a day. So do those things baseline, and then we'll give you some tramadol, which is like, if you need more, that start with the tramadol, right? You can take those with ibuprofen and Tylenol, perfectly safe. And then if you need more, we go to the oxycodone, which is like the strong narcotic medicine. So that's kind of your stack, right? You start off with ibuprofen, Tylenol, take that baseline. Okay, take that baseline right after the operation, and it'll all be written down for you, how much to take. And then you take the tramadol if you need it, and you take the oxycodone if you need it. Now, if you come in after your 2-week appointment and you tell me you never took any of this medicine, I'm going to give you a high five, right? Like, it doesn't matter to me. If you take all your medicine, that's great too. I would prefer you minimize how much narcotic you take just because of the side effects, and try to take more of the lighter ones and then kind of tear up. But that's why we give it to you, because it is an operation, right? Like, and you need to have pain relief. So try not to get too focused on it. It's there if you need it, and there's plenty of it. And there's a lot of different ones so that you're not having to take a lot of the strong stuff. And most of our patients are off all the narcotic medicines with this operation within a week. Honestly, it surprises me how little of it they actually take. Other things to do are ice your shoulder down. So ice your shoulder. We're going to give you a big ice pack, or we'll get one at the at the surgery center. But it's just a big sheet of ice. You don't need to get one of those machines. Don't worry about the Game Readies or the bucket, or it's like attached to the tube. Those are terrible. They're so expensive and they're inconvenient. But just an ice pack, and do it for about 15 to 20 minutes, 4 to 5 times a day. That's a great way to get pain relief without having to, take medicine, right? It's very safe and it's very effective. And make sure, especially before bed. I'm a big believer in exercise for pain relief. When you get endorphins flowing, those are powerful pain relievers. You just can't do a lot of vigorous exercise with your operative shoulder, but you can work the other shoulder, you can work your legs, you can do cardio activities like riding a stationary bike, taking long walks, working your legs out, those types of things. Those are great pain relievers for your operative shoulder. By kind of getting your body moving and getting your blood flowing, you'll feel better. And then meditation, this is a big one. And so we're going to send you some, our coordinator will send you some videos to watch on YouTube. You can listen to them before you go to bed. But the mind is a very powerful tool in order to help keep our pain under control. We have a tremendous influence that most of us don't realize in terms of being able to, compartmentalize pain and what it means to us emotionally and from a stress standpoint. And the way I think of it is, pain is pain. You can be 10 out of 10 or 1 out of 10. But you can actually, by doing certain exercises mentally, take something that's a 7 or an 8 and bring it down to a 1 or a 2. And we all know that when we're in pain, whether we're having surgery or not, before or after surgery, it waxes and wanes, right? So there's periods of peaks and there's troughs. When you're like, it's really bad today, or it's really bad right now, it wasn't that bad before. Well, you can use your mind to make it so it's those periods where it's not that bad, right? You can use your mind. And so we'll send you some of those videos to listen to or watch. They're very, very powerful, and it's just one more way we can help treat your pain, other than the medications and everything else we're doing. Your diet, so anti-inflammatory diet is huge. Minimize how much alcohol you're drinking. Make sure you're staying hydrated. Try to eat a higher protein, lower processed foods, right? So that's like things in packages, things with high sugar. Avoid white starchy carbs, avoid a lot of saturated fats, which are fats that are solid, fats that are liquid or unsaturated. Solid is, I still eat butter, but I think, you don't want to be eating like a stick of butter a day, but try to stick to, clean, healthy proteins, which are chicken, fish, lean ground beef, lots and lots of vegetables, a large variety of vegetables. Fruits are okay, but they do have some sugar. So try to eat the lower sugar fruits like, blueberries, raspberries, strawberries. Bananas are okay, but some of the other fruits like oranges and things like that can have a little bit more sugar than we like. But really just try to stick to more natural foods, higher protein. I tend to be a lower carbohydrate. If you do eat carbohydrates, try to make them like wheats, more whole grain than more processed carbs, and healthy fats, which are like olive oil, avocado oil, omega-3s from fishes, etc. And just kind of stick to that clean Mediterranean healthy diet, and it'll just help you heal faster. You'll feel better. Another thing is if you tend to get constipated from narcotics, or if you're worried about that, pick up some Colace or Metamucil when you pick up your pain medicine. And that's what you do if you get pain medicine. And also make sure you're getting plenty of fiber in your diet. So you're going to get a nerve block you're going to get a nerve block in your shoulder right after the surgery, or right before the surgery. And so you won't need any pain medicine for the first 24 to 36 hours. But after that, you will probably want to take some. It's the second or third night where people tend to have the most trouble, because that's the night the nerve block wears off. So I recommend people, the first night you really don't need much strong pain medicine because you know the block's going to get you through. But that second night, take one of the strong pain pills before you go to bed. That way you just don't wake up with nothing in your system, and you don't it's 2 a.m. and the block wears off and you're like, oh my gosh. And then after that, you can kind of dial it in and see how you feel. Yeah, and again, take as much or little as if there's medicine. So the next thing is the antibiotic scrubs. So we'll talk about this in your pre-op appointment, but there's a couple of washes that we give on your shoulder. It's just to decrease the bacterial load. There's 2 washes that we do for 2 different types of bacterias, but our staff will go over that with you in your pre-op appointment, and there's some very specific directions on making sure you do those a couple days before surgery. If you don't, it's not the end of the world, but we do feel like it helps decrease the bacterial load on your shoulder, which theoretically does decrease infections. It does, which is a huge thing for us to minimize that. So the sling, this is people are obsessed with the sling. So we're going to give you a sling. You're going to need to wear it for the first 1 to 2 days if you get a nerve block, which most people do, because your arm's going to be like a limp noodle. That's that's the trade-off, right? If you get a nerve block, you don't feel anything, but you're not moving it either. After that nerve block wears off, when you can start to use your arm, and then the sling becomes completely optional, right? You do not need to wear it. I will repeat, you do not need to wear that sling. Most patients tend to feel more comfortable wearing it out in public for that first 1 to 2 weeks because they're just kind of getting used to their, operative shoulder, and it's just a comfort thing, honestly. But even if you don't do that, I don't care. But most patients choose to wear it. So that's why we still give it to you. But you don't have to wear it. You do not need to wear it when sleeping. I'll repeat, you do not need to wear your sling when sleeping. If you want to, do it. If you don't. It's purely for comfort, honestly. It's just a comfort thing. And we're going to get you fitted for the sling in your pre-op. There's going to be kind of this pillow here. If you don't like that pillow, take it off. Okay? If you don't like the pillow, take it off. If you don't like any apparatus that's around your waist, take it off. Some people like it, some people don't. It doesn't matter. It's just there to try to make you more comfortable. You're going to see that the majority of surgeons that do this surgery want you to wear a sling for 6 weeks and stay in it at all times and not move your arm. For us, we've been doing this way for 10 years. And when you look at the data, right, there is no difference in complications or problems when people don't wear slings after this operation, right? So that's the key. That's why these other people are making you wear it, or surgeons, because they're concerned about that. But when you look closely at the data, there's no difference. However, there is a huge difference in terms of the quality of your life and how easy it makes it on you as a patient if you don't have to wear it all the time, right? So wear it if you want. Don't. Know that you're perfectly safe to not wear it. The key is just to let pain be your guide. We'll talk about movements and things like that later in the video, but just in general, just let pain guide you and you're going to be safe. And I've actually found slings to be to actually make people worse, right? In some ways, because you get very scared and it's like this signal to your mind and body that something's wrong with you. And it almost makes you feel like you should hurt more. It's like this kind of anchor to surgery, like a psychological anchor to the pain of surgery. And so I've just found that when people don't wear slings and they get out of them, it just frees up their body and mind. They have less pain, they have less discomfort. It is kind of an unnatural position to put someone in for long periods of time. And so just, even if you do want to wear it, make sure you're taking breaks from it frequently, because it's good for your arm to get out and move a little bit. But yeah, in general, I feel like, people's lives are just so much better if they're not forced to wear that sling, and it makes your life easier. It improves the speed at which you get better. It's not like it slows you down. It makes you get better faster and have less pain. So we're not I guess we are anti-sling a little bit compared to everyone else we are. Okay. And it just, again, I actually encourage patients after 2 weeks after the arthroplasty to just get out of their sling. Just stop wearing it. You'll just feel better. Okay, so motion restrictions. So let's start with reverse shoulder. If you're getting a reverse shoulder, which is, the majority of our patients getting their shoulder replaced, getting a reverse. There's 2 types, reverse and anatomic. We'll talk about which one you're getting before. It's not a huge difference. So don't get obsessed about it in terms of post-op protocols, etc. But with the reverse, we allow full motion like this right after the surgery. Okay, from day one, you can go like this as much as you want. Again, let pain guide you. You can go out to the side I would say about 10, 15 degrees out here. Okay, so kind of pretend there's a wall over here. All right, we don't want you going up behind the back for the first 6 weeks just because it's very uncomfortable. But you can use the restroom by kind of going in the front. And then, you can cross the body here. So the key is, none of this for the first 6 weeks, as much of this as you want. Keep the lifting less than 5 pounds for the first 3 months, but really with an extended arm, because that makes the lever arm big. If you're down in here, you can lift more. Again, let pain guide you, but out here, okay, with your arm fully extended, with your arm away from your body, we want to keep the lifting less than 5 pounds. So in here is safer. You can do a little bit more. Try not to push it. Don't do stuff that hurts. But really, when we say 5 pounds, we're talking about with a fully extended arm away from your body, because you think about a lever, how much more force that puts across your shoulder and the joint when you're out here versus down in here. It's a massive difference in terms of the stress and the shear across your shoulder. So really, that's what we're talking about. After 6 weeks, you can move your arm as much as you want, so no restrictions on movement. After 3 months, you can start to lift as much as you want, no restrictions on lifting. By 6 months, you should have back the vast majority of your strength. You should be feeling really good. And that's it. I mean, it's really simple. The therapist will kind of go through all the other exercises in more detail. But again, remember that you can do all activities of daily living right after the surgery without fear of damaging anything for both of these types of operations. For total shoulder arthroplasty, the only difference is that we don't want you when we elevate, we want you to go like hand to head for the first 6 weeks. Everything else is the same. So you can go out here, don't go rotate out more than like 10 degrees or so. Don't go behind the back. Keep it less than 5 pounds. And for the first 6 weeks, we would just want hand to the head. We don't want going crazy high. Part of that is because the subscapularis it's repaired in both operations, but if it fails in an anatomic, it's kind of a disaster. If it doesn't heal in the reverse shoulder, it doesn't really impact the income. It's kind of like outcome. It wasn't really meant to be, sort of, is the way I think of it. So again, we don't have to be as protective with the elevation with reverse. That's the only difference between reverses and anatomic. Everything is the same. So after 6 weeks, you can go move it as much as you want. After 3 months, you can lift as much as you want. And our therapist will be able to go through these protocols again with you, but just know that's kind of the general gist. And again, you can put on your clothes, all the other activities of daily living that you need to do, showering, all that stuff, perfectly fine. Okay. And the key again is just to let pain guide you. So a couple things. Again, huge concerns patients have. Women for bras. We have a video on this, but for a bra, I'll just tell you again, you turn your bra around backwards. And scooch this video down a little bit. So you turn your bra around backwards, buckle it, and then spin it around, and then you're gonna put one arm down here like this, one arm down here like this, and then pull it up, right? That's an easy way to put on your bra. To go to the restroom, you're gonna have to come from the front or use your other hand. That's like, for the first 6 weeks, that's what you're gonna need to do. We already discussed lever arms, so that's fine. So sleep, this is a huge concern. The first thing people ask is, I'm gonna have to sleep in a recliner. No, you're not gonna have to sleep in a recliner, okay? You do not have to sleep in a recliner. They suck. Like, that's not a fun way to sleep, and you don't have to do it. There's no reason for it. It doesn't make any sense. And it's just old surgical dogma that's just passed down for the generations, right? Now, if you want to, fine. And my policy with sleeping is sleep however you want, right? If people always ask, can I sleep on my operative shoulder? Yes, you can. Will you want to for the first couple of weeks? Probably not, but if you want to, go ahead. You're not going to damage it. That implant is super strong, but you did just have surgery on it, so it probably won't feel great, but people surprise me sometimes. You can sleep on the other side. You can sleep wherever you want, on your stomach, on your back, whatever. My recommendation, and what I have found to be the most comfortable position for the majority of patients, is to sleep in your own bed, okay, with 1 or 2 pillows up your back on the backboard or against the wall, so you're elevated about 20 or 30 degrees. Take your sling off or wear your sling, whatever you want. You don't have to wear your sling, but put like 1 or 2 pillows underneath your elbow, and it just kind of keeps your arm propped up and in this stable kind of ergonomic position that's the most comfortable. So let's say this is like operative left shoulder. That's the position I have found to be the most comfortable to sleep in, but experiment, figure out what works for you, right? It doesn't matter to us, whatever works for you. So therapy after surgery, we do recommend some form of physical therapy after surgery. You can do the traditional in-person therapy. I prefer, if people are going to go that route, I want them to wait about 3 months before they go physically in person, because I don't want the implant being overstressed by too aggressive a therapy. If people really are insistent on doing it though, I'm okay with it. I have some home videos that I've made for patients that are just me talking about exercises to do after surgery that we can give you. Incision care. So the incision for this surgery is about 8 centimeters, all right? So the width of my hand, sometimes a little bigger, sometimes a little bit smaller, depending on the size of the patient. And it goes right here from just below the coracoid, which is the front of your shoulder here, right there, all right? Very cosmetic scar, almost difficult to tell you had an operation. So about a roughly 8 centimeter incision, which is about 3.5 to 4 inches. Okay, so right here, very small incision, okay, relatively. The dressings after the surgery are completely waterproof, so you can shower. That's a huge question people have. Can I shower? You can shower right after surgery. You can shower every day after surgery. Everything's waterproof. And so that's great. Don't worry about not being able to shower. Don't soak any pool or tubs for like 3 weeks because you soak in water can get down into the incision. It's actually good for water to run over the incision. It keeps everything clean, keeps your skin clean. The dressing's waterproof, but just hypothetically, if it fell off and water was run, we don't care. Like that's actually good. We like that, but we just don't want soaking because if it soaks, then it can get down in there, which can cause an infection. If your dressing does get wet, like the waterproof loses its seal, don't worry. We can get you more. It's very easy for us to do that. You can even go to a drugstore and get more. It's simple. So don't get too concerned. Just call our office if that's an issue. If you notice some blood on your dressing. So, bleeding is normal after surgery. Everyone's a little different. If you notice that the dressing gets saturated in blood, do not panic. Do not panic. It's fine. We'll just change it, right? And typically after one dressing change, that stops. Right, that stops. So don't get too concerned. But we don't want like a blood-soaked dressing sitting on your shoulder for a long period of time. It's just not great for your skin. So we want everything just to be clean and dry. If there is a little bleeding after the surgery, it's fine. Happens. We'll just change the dressing. It'll be okay. All the sutures are placed underneath your skin, so no need to take any sutures out for the majority of our patients. And so that's nice. It's just a Dermabond with a Steri-Strip. The Steri-Strips will fall off over time as you shower, so don't worry about that. And then we typically want some sort of check. Again, we can do the phone call or you can come in person after around 2 weeks just to make sure everything looks good. If you want to use scar creams, go ahead. I would wait like probably 3 weeks after the surgery to do that. We have found that they're not really necessary, but if you want, you can go get some scar creams online. Just Google scar cream or Amazon scar cream. Vitamin E oil is one that I've seen people use. But in general, it heals up very nicely and scars just naturally, heal over time. Our body heals. You don't need to do anything extrinsic to make them heal faster. And this is a very nice thin cosmetic line. I mean, we use a nice plastic surgery type closure where it's just a very nice clean scar and you don't have to do a lot of work on your end to make that happen. It's really how we do the closure in surgery. But if you want to use it, go ahead. Just wait 3 weeks after the surgery. Okay. That's it. So a big one, bruising and swelling. So this is normal, right? So we're going inside your body. We do a muscle sparing, bone sparing approach, but we do have to, open up some windows in your shoulder and perform an operation. There's going to be some bleeding. Everybody's different in terms of how much they bruise after surgery, but you're going to have some bruising down your arm. Now it may be black and blue. It might not be black and blue, but there will very likely be some bruising to some extent. Do not get concerned. Okay, expect it. Expect your arm to be black and blue, and that way you won't be concerned when it happens. It's perfectly normal. Everyone gets it. It will go away after around 3 to 6 weeks. All right, that's how long it takes for it to go away. And it doesn't typically appear till a couple of days after the surgery, and it builds typically around that first week. You'll see it becoming more and more dark. But that's just natural bleeding that happens after the operation. It's unavoidable and it doesn't really matter. It's just something that occurs. So don't get concerned about that. And just expect it. Expect it, and that way you won't be surprised if it happens. You're gonna get some swelling down your arm. You're gonna get some swelling in your forearm, you're gonna get some swelling in your hand. And when we see, even though we're replacing your shoulders, patients report some swelling in their forearm and their hand. And their shoulder feels amazing because we're replacing the joint, but they kind of get this soreness in their forearm and their hand. That's normal. That's normal. I promise you, we're not touching your arm, the other parts of your arm. It's just the bleeding that goes down your arm from the surgery. And when there's blood in a place where it shouldn't be in the human body, your body says, I don't like this, something's weird here. And it sends off all the inflammatory cytokines to your brain, which tells you that something's wrong, even when something's actually not wrong, right? Like there's nothing damaged in your arm or hand. So don't worry about that. It will go away after a couple weeks. It's of no concern. If you feel like it's really, really excessive, you can barely move your fingers, call us and let us know. But general swelling, bruising down the arm, all that stuff is normal and it will go away. And pain in your forearm and hand can happen after a shoulder replacement. It's temporary. It's relatively mild in most patients. It's 99.9% of the time it goes away. Okay. And you may notice some tingling in your fingers. That can be from the swelling. That again is temporary. So just know that that will eventually go away. And coming out of your sling more will help decompress the nerves in your elbow and also your hand too, so that doesn't happen as much. Clicking and popping, that's normal. We're putting this mechanical joint in there. There's fluid, there's scar tissue that's been released and then building back up after the surgery. All that's normal. We do not get concerned about clicking and popping unless you're getting a large amount of pain when it happens. If it's pain-free clicking and popping, no, that's just your joint kind of finding its home, and it's just post-surgical stuff that typically goes away. Even if it doesn't, if it's not painful, don't worry, and it's normal, and you may feel that, and you probably will feel some of that, but don't get concerned unless it's painful. That's the key. Recovery time. So in general, most of our patients come in after 2 weeks and they have less pain than they did before, right? So that's a great thing that, you don't go like after shoulder replacement, you don't go here and then up here, you just got to go like that, right? In terms of your recovery and how you feel. But you are still having surgery, and there is a timetable here for how quickly you're going to be amazing. You can do all your activities right away of daily living. So that means putting on your clothes, dressing, driving a car, which we'll talk about more. Pretty much everything you need to do to get through the day is perfectly safe right after the operation, right? And then after 3 months, you can lift as much as you want. That first 3 months, again, we want less than 5 pounds with you extended. In here, you can lift more, just kind of let pain guide you. If your arms are down tight, but if you're out here, keep it lighter, and you'll feel that. You'll know that you shouldn't do that. Your body's just not ready for it. And that's pretty much it. The recovery is pretty quick for this procedure. I'm always amazed at how well people are doing in relatively short amounts of time. Again, the PROM scores, so make sure you fill those out before surgery. You're going to get an email with those, and make sure you're filling them out post-surgically, right? You'll get the scores at 2 weeks, 6 weeks, 3 months, 6 months. This data is precious to us in order for us to continue to analyze what we're doing, how we can get better, and also communicating with our patients, what to expect after this operation from a very objective standpoint. And we also ask that at actually most of our appointments, especially typically at around 3, especially 6 months, we want to know where you're at and how you're feeling. Driving, this is a huge question. I'm here to tell you, hopefully you're very excited about this. You can drive right after the operation as soon as your nerve block wears off, right? Which is like a day or two after surgery. We allow this right away, so that's all you need to do to drive. So if you're not taking the super strong pain medicine and you feel comfortable, okay, that's the key, you have to feel comfortable, you can drive right after the surgery. People that are concerned, I'm like, if you don't want to drive, don't drive, but I'm not going to tell you can't. If you want to start off safely, sometimes it's good to have like a family member or a friend in the front seat and just kind of drive around the block and just see how you feel. And if you feel comfortable, then you can go to the grocery store and just common sense stuff. But if you feel comfortable and you feel safe, you can drive right after the operation. Other one is work and travel, right? We live in an age when most people are knowledge workers, right? There are still people that do manual labor, but a lot of people, it's knowledge work, meaning you're at a desk, you're talking to people, you're, directing people with your hands, whatever. You don't need to use your shoulder for your job for a lot of us. If that's the case, then, you can go back to work whenever you're ready. I typically recommend just taking the first week off. We typically do these operations on Tuesdays and Wednesday mornings, or Tuesday mornings, Wednesday afternoons. But it's still surgery, right? And just the stress of undergoing anesthesia, and it is stressful on your body and your mind. Could you go back to work that Thursday or Friday? Yes, you could. I wouldn't stop you, but in general, I say just do yourself a favor. Just let yourself rest that first week and then go back after a week. And then you'll feel, just kind of know how your body's doing, and it's just less stressful trying to manage everything else from the surgery and then trying to go to work too. It's just take the week off. It's surgery. You're getting your shoulder replaced. It's not, still surgery. Travel, you can travel right away. No restrictions on travel. Try to get up and walk, if it's a long flight, just to prevent blood clots in your legs, which is, you should do that no matter what. There's no increased risk after shoulder surgery. We're so quick in the operation. I mean, we typically do this surgery pretty quickly. So that's not a huge concern of ours. But yeah, you can travel right away. You can take long drives, whatever you want. No restrictions on travel. Again, reverse versus total. We make this decision on a lot of different factors. Sometimes in the office, I can tell pretty quickly, oh, you for sure are going to get a reverse. Some patients I'll be leaning more towards an anatomic total shoulder, which the difference is like the way the ball and socket are. In a reverse, the ball and socket are flipped. That's why it's called a reverse. So the ball is where the socket was, the socket's where the ball was. And an anatomic shoulder, it's metal and plastic, very similar, but it's similar to your anatomy, right? And which one we do depends on many factors. I really can't make the final decision until I get on my computer and I look at your scan and I do the mapping and the planning there. In some patients, I'll know right away that you're going to get a reverse. There's some patients that are kind of tweeners. Typically our younger patients is the ones where I might do an anatomic, but I don't know until I get on that computer and I start to map everything out. Just know that it doesn't matter for you, right? Like the rehab protocols are the same. The recovery is very similar. If you go look at a bunch of stuff online, they're going to talk about all these differences. Again, that's old data. It's old data. When you look at contemporary modern shoulder surgery done by a hyper-specialized surgeon who does a tremendously high volume of these things, there is minimal difference in the outcome that the patient has and very minimal difference in your recovery and what you can and can't do, et cetera. And even the surgery, the sets are the same. Like it's the same trays that we have in there to do them. And they're so interchangeable. So just try not to get too caught up on this. It doesn't really impact you that much. It's what we put in. And the reason why there's a difference is we're trying to give you a shoulder that lasts for 20 to 25 years versus one that lasts for 5 years, right? And it's different for every patient. Okay. How long does surgery take? So it's quick for us. We are in the top 1 percentile in terms of the efficiency of the operation. This surgery takes less than 30 minutes for us, skin to skin. And if you look online, and for most surgeons, it's going to be 2 hours plus. Why are we so much quicker? Well, I talk about, there's 3 or 4 things that go into that. One is we've done over 1,000, right? So just repetition, volume, doing a ton of something, you just naturally become more efficient at it. We're hyper specialized in shoulder. We've always been a high volume practice. So that is a huge part of it. The second thing is the technologies, right? Like, using those computer programs to map everything out. Now I take a lot of the things I used to have to do in surgery, right? And now I can do them out of surgery. So I'm removing steps that were required intraoperatively, trialing, templating, shaping things. Where does this go? How does this fit? How does this feel? I do that on the computer now, okay? So when I go into the surgery, I'm basically just putting in the parts exactly how I map them out, which saves a massive amount of time. We have these 3D printed models of your shoulder and guides. I've got those up on computer screens when I'm in there, so I can see everything very clearly. And so in my mind's eye, I already know how it's going to go. And that just speeds things up. It just makes things so much quicker. It minimizes any bumps in the road. It minimizes any surprises, and it just makes things clean. The techniques we use, smaller incisions, muscle sparing techniques, bone sparing techniques. Those things help, make things go quicker. My team, right? I've got my 2 PAs, Haley and Jess, with me on all surgeries, and they've been with me for years. They know I told people we don't really talk that much, right? Because it's almost just this kind of symphony of motion between all of us. And then our technicians work with us exclusively. So and there are reps too. So the nurses, the reps, the techs, the PAs, we all work together as a team to try to make this be very efficient for you and achieve an excellent outcome with a perfectly placed implant. And we want to do it in the shortest amount of time possible, because the shorter your surgery time, the fewer infections you have. Okay, this is a undeniable fact of surgery. The longer you are open to the world, the more chance your body can get infected. So we want to strive to shorten that time down. Also, the longer you're under anesthesia, the more issues there can be. Like if you have a 1-minute surgery versus a 10-hour surgery, there is a huge difference in the stress on your body and the amount of drugs you're receiving. So we want to shorten down those windows. And what I've also found is that people hurt less with the surgical time. It's just less stressful on their body and mind. So there's a ton of reasons to do efficient surgery. People always say, are you guys rushing? Well, of course, we would never do that. we would never do that. It's actually, if you watched it, it doesn't look like there's nothing hurried about it. It's just a very, very efficient system, and everything is just moving very, very cleanly is the way I think about it. But yeah, so we really strive to make that happen, and it makes our patients' lives way easier. Another huge question is, do I have to stay in the hospital? No, you don't. We do 99% of these as outpatients now. So you're gonna come in, you need to be there 2 or 3 hours before the surgery. You're gonna have the operation. It's gonna take about 30 minutes, but then you gotta recover for 45 minutes to an hour afterwards to make sure you're safe, okay? Your family's gonna come in. They're gonna be watching this video hopefully beforehand or during the surgery. So everybody's gonna be perfectly comfortable, and then you're gonna go home and you're gonna follow up with us however you choose. So it's great. Patients don't wanna stay in the hospital, and that makes things way just more convenient for everyone. Exercise, again, make sure you exercise right after the surgery. And even if it's something as simple as taking a walk, a 15, 20-minute walk every day, it will help your mind, okay? It will help your body. It will help you recover. You will have less stress. You will have less pain. You will be a happier human being. So I don't tell patients you can't exercise. I say you should exercise after surgery. I think it's so important to help speed up your recovery and just get your body and your mind flowing and moving. It's so vital to our health and well-being. It's just hard to understate that. And so not only should you exercise, you should exercise, and you can work your legs like crazy. You can work your other arm like crazy. I encourage that because it'll help the other side bounce back. Ride a bike, take a walk, whatever you need to do. Yeah, so that's it. Hopefully this answers all your questions. We're excited.